headaches, heart disease.
The way you think, the way you go about your life.
Taxes you one way or another.
Stomach aches. It all depends. Your nerves.
Stress is the #1 killer out there right now.
Today, Americans are experiencing more stress than ever before. In fact, research continues to show that about 80 to 90% of all diseases are related to stress, from cancer, diabetes, hypertension, depression. The list is endless. Welcome. I am Ruth Tanya. Today we begin our series on stress. In over 12 years as a nurse, I have seen firsthand the effects of stress. It is deadly. So I think this series is extremely important because if you understand how to manage stress, you can potentially prevent the majority of chronic diseases. So stay tuned as we show you how. Welcome back. Throughout this series, we will meet people who experienced high levels of stress and as a result developed a disease. Meet my first guest, Leon, who almost died because of uncontrolled stress.
Hello, I'm Leslie McKnight and I live in San Bernardino, California. I was working a job where it was required for me to accomplish a lot of tasks and it was really too much on me. But I was unaware that I was being stressed out doing this job until I went for a routine doctor's checkup, and that's when the doctor told me my blood pressure was so high that I should be dead. It was that high, so I was really scared, and he wouldn't let me go to work for 2 days. I didn't know I was being stressed out like that. I just thought everything was normal, but until the doctor told me my blood pressure was up like that, that's when I realized that there's a lot of people that are walking out there that are unaware that their blood pressure is that high due to stress. That's what the doctor was telling me. He was so worried and panicky about my blood pressure being that high that he put me, I went to Arrowhead Hospital. He had me go over there, and that's when it finally came down after 2 days. But my blood pressure was that high, and it was all due to stress.
Welcome to the show, Leon. So, in the video, you said you almost died because of stress and you did not know what was going on. Tell me about that. Didn't you feel any symptoms of stress?
I felt a little dizziness, and a lot of the symptoms I felt, I was unaware that it pertained to my high blood pressure. I just kept pushing on like everything was okay. But like I said, when I went for a routine doctor's exam, that's when I realized my blood pressure was sky high and the stress had taken a toll. I didn't realize I was up under that much stress, but I don't have the paperwork on how high my blood pressure was, but it was so high the doctor told me to stay off work for 2 days, and he tried to stabilize my blood pressure. The stress was building up in me,
right.
But I was unaware of this.
Right, and you said that you think there are people out there who are going through what you went through, but they cannot make the connection, or they are unable to make the connection between stress and health. You think so, right? That there are people out there experiencing this. I think so too. So I went out to the street to talk to people about stress and health. This is what they have to say.
How do you define stress?
Headaches, heart disease, stomach aches. It all depends. Your nerves.
The way you think, the way you go about your life.
Stress is the #1 killer out there right now because of the frame of mind that everybody's in with all the different diseases, the high blood pressure.
Whether you have a good attitude or not.
If the frame of mind is not correct, well, neither will the body be.
I think it's a matter of a lifestyle, whether you have a happy one or whether you don't.
Stress is something that taxes you one way or another. It's something that you don't normally encounter. It can be at work or so forth. And yeah, I do believe stress can lead to at least bad health.
They get sick, then there's stress. Like me, I've lost my sight, and it's stressful because I have to depend on other people.
You can't function anymore, and that leads to breakdown, anxiety attack.
Do you think our society is contributing to our stress level? Technology, cell phones?
Oh, absolutely. Absolutely. The higher tech we go, the worse it gets on us. It's because it's always blamed on a computer, or somebody did something wrong with the input on the computer. So the higher technology we go, oh, absolutely. That's why it's the #1 killer.
Welcome back. With me now is Dr. Ree, medical doctor, and you also have a PhD, and in your PhD you study stress. Tell us a little bit about that.
Yes, my study involved mechanisms of stress, and mechanisms of stress involved changes in the brain chemicals, and I studied how the changes in the brain chemicals affect the changes in the body, and sometimes these changes can lead to disease.
Absolutely. So you've been listening to the people in the video, and you were backstage listening to what Leon had to say about not recognizing the symptoms of stress. So anything you want to add to that?
Yeah, many times stress is an everyday event. So it's not something that is necessarily out of the ordinary. So most people don't recognize it until the symptoms become so bad that the symptoms affect their routine. And that's when the stress symptoms actually become accentuated, and that's when symptoms can become disease. And until symptoms become severe enough to become a disease process, people don't recognize it.
Right. Symptoms such as the difficulty with thinking, like Leon mentioned, insomnia, difficulty with sleeping, feeling overwhelmed. I would think, though, that those are signs that something is not right.
Yes, so that's why I think it is very important to educate the population that recognizing early signs of stress as opposed to waiting until it's too late or waiting until a disease comes on, I think it's very important. And early signs of stress actually can become very, very easily recognizable only if we educate the population.
Right. So let's talk about some early signs of stress. We talked about difficulty thinking, your heart rate is beating twice as fast, difficulty with sleeping, no appetite.
I can talk about the 3 most common things that are involved in the changes in the brain chemicals that affect directly the body in response to stress. And the 3 main things, number 1, there's a feeling of uneasiness. And a feeling of uneasiness actually is a result of break in the balance of brain chemistry. The second thing is having no time for any kind of enjoyment.
Right.
No time for pleasure, no time to relax.
Right. Feel like you're on the go all the time.
Right. And there's no, for some reason, people can't enjoy things anymore.
Yeah.
And thirdly, one of the most common things is like inability to concentrate.
Right.
And that leads to insomnia as well.
Right. Well, let's take a quick break. When we come back, we will talk more about things to watch for.
Coming up.
The stress hormones can actually constrict the blood vessels.
Initially, you feel uneasy, jittery, and then eventually you feel like you feel almost numb.
Then later.
Now, when you're under severe stress, you actually have a depletion of serotonin function.
The doctor told me my blood pressure was so high that I should be dead. It was that high, so I was really scared, and he wouldn't let me go to work for 2 days. So he put me on some medicines, and it actually took 2 days for the medicine to bring down my blood pressure to be at a stable level so he could allow me to go back to work. And once I got back to work, I got with my friend who's a health fitness expert, and he told me how I should change and alter my diet, and I had to completely change my diet. I had to do a 360 on my diet in order to get my blood pressure at a stable level, and it's been stable ever since I've done that. And but the stress, the scary part about it is stress. I didn't know I was being stressed out like that. I just thought everything was normal, but until the doctor told me my blood pressure was up like that, that's when I realized that there's a lot of people that are walking out there that are unaware that their blood pressure is that high due to stress, and they're one step from falling out.
Your stress level is like right up here. How are you managing that with fibromyalgia?
Well, I don't think I'm managing it very well.
You're not managing stress and it's hitting your body. You are ramping up constantly in a sympathetic or a fight or flight kind of arousal.
People are actually not able to manage their anger in a very rational way. They actually have emotional outbursts.
Yes.
And that anger actually will cause a 7-fold increased risk of heart disease.
My name is Joanne Moore, and I'm a preschool teacher here at Cal State San Bernardino's Children's Center. I've been here since January, and I'm very, very grateful to be here. I came from a really stressful situation. Management was not appreciative of the talents that we had, and I felt like I wasn't being appreciated. And so work hours were something that I dreaded, and hypertension became a daily part of my life. I didn't realize it at the time until I went for a routine checkup. I never had high blood pressure before, so I really couldn't understand that. And I've always been big, but I've always been healthy. I realized that it was due to the stressful situation at work. My mother was also passing away, and I didn't realize that. She was quite old, but at one point I went to work, and I was to see 6 children that day in 2 different families. I put the files out on the desk and thought, okay, I'm going to make this a good day. Unfortunately, I just broke down.
Welcome back. Today we are talking about stress and disease prevention. Thank you for joining us, Joanne. On the video, you were talking about how you felt overwhelmed going to work. You did not like your work. You were afraid. Unlike Leon, you actually recognized that something was wrong.
Yes, yes.
Tell me a little bit more about that.
Well, I didn't feel comfortable. I couldn't pinpoint what it was, but every time that I would try to approach management to let them know that I think I need some time, there was understandable excuses. So that by the time I got to work, and that one day, which is still burned into my memory, the exact date, I couldn't tell anybody, which added to my stress.
So both of them experienced, as a result of uncontrolled stress, unfortunately, developed hypertension, high blood pressure,
Yes.
and in your case, clinical depression.
Also.
We will talk about depression later on. Dr. Ree, we know that essential hypertension is strongly related to lifestyle stress. Let's talk about that in terms of the stress hormones. The stress hormones can actually constrict the blood vessels within the walls, and as a result, the pressure goes up. And if the stress is not controlled, eventually you develop high blood pressure. So let's talk more about that and stress in terms of the mechanisms.
Okay. Well, when we talk about stress, the first hormone that comes to an expert's mind is adrenaline, and everybody knows adrenaline.
Yeah.
More fancy term, fancy term for adrenaline is norepinephrine or epinephrine.
Oh, okay.
Right.
But we're more used to the term adrenaline. And when you're under a lot of stress, the brain produces either too much adrenaline, and as a result of too much production of adrenaline, sometimes your body is unable to actually respond to adrenaline very well. So either it's too much adrenaline or too little adrenaline response. And that can lead to a couple of things. Initially, it could be jitteriness or uneasiness or nervousness. But eventually, if that situation gets prolonged, your body is unable to respond to adrenaline, and that results in lack of concentration, and that results in inability to focus. And there's something uneasy about the whole situation, but you just cannot quite pinpoint it. And that's kind of the basically a spectrum of stress response. Initially, you feel uneasy, jittery, and then eventually you feel like you feel almost numb, unable to concentrate, and you just sit there not knowing what to do. And that's a imbalance in brain chemistry. And you can reverse that if you recognize it and if you change your lifestyle.
Absolutely. And in your case, you unfortunately developed depression. And obviously, the stress hormones are very bad for the cells of the brain, and they can affect the neurotransmitters, the serotonin. And as a result, these cells are unable to function optimally.
Sure.
So let's talk about that briefly before we take a break. The connection between stress, uncontrolled stress, and depression.
Okay, very good. Then at this point, I can mention the 3 hormones that I love to talk about.
Right.
Okay, first hormone I talked about in terms of concentration or focusing was adrenaline. Second hormone that Ruth is just actually bringing up is the serotonin, and that's the one that actually gives you the feeling of stability.
Right.
And when you have enough serotonin function, you feel stable, you feel calm, and you feel like your life is secure.
Right.
Now, when you're under severe stress, you actually have a depletion of serotonin function, or serotonin is a hormone that is supposed to be normally released in your brain and throughout your body, but if they're not produced well or not released properly, then you actually feel very, very uncomfortable, insecure, and unstable. And that is actually the key hormone for depression if the situation is prolonged. But there are other ways to raise your serotonin levels.
Right. And we will talk about that throughout the series. So, Leon, did you experience any signs of depression?
I just got up when I went to work. That's all I did was went to work, went home and sleep, got up, went to work. I mean, I didn't have any recreation whatsoever.
Yeah. Okay, let's take a quick break. When we come back, Dr. Ree is going to illustrate to us what goes on in the body when we have high levels of stress hormones. Stay tuned.
Coming up.
Serotonin, dopamine, and norepinephrine. Now, when you're under constant stress, you may have imbalance in any one of these hormones or all of the hormones.
I have type 2 diabetes, and I've had that for probably 30 years.
I've had diabetes since 1995.
I have watched all of the Bad Sugar series.
I have had diabetes since 1998.
I've watched the TV series Bad Sugar.
I'm a type 1 diabetic, and it's taught me how I can expand my lifestyle. It's taught me spiritually how to monitor my stress. It's taught me how, when I have an onset, how to calm myself down, my nutrition, how to exercise, and how I can fulfill my life without looking over my shoulder.
They clarified everything that the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
One thing I loved about it, it was pointing out, all of our new technologies and how the new, where we think one way that we're advancing in our technology, however, it's causing more stress if we don't monitor it.
Oh, I thought I knew, but I didn't. I had little knowledge, but that series expounded my knowledge.
For me, Bad Sugar have played a major important role in my life to control, to educate, and to teach others about diabetes.
It showed how God operates through us and how we need to connect with God in order to make sure that those sugars operate the way that they're supposed to.
Bad Sugar can teach you things that you know not of. It can help you expand your life. It can stop the problems, the health problems that you're going through. It can help you advance.
Bad Sugar.
There was things out there that I didn't know, and since I watched Bad Sugar, it's given me a lot of information that will help me further out.
Type 2 diabetes affects a lot of different things in your body, which I never knew about until I saw the episode 7, 8, and 9.
I really find it very, very interesting and very knowledgeable for my health, how to understand, how to maintain, and how to eat properly to be able to control this disease, diabetes.
It's taught me about nutrition, it's taught me spirituality, and it's taught me how to live my life and enjoy myself longer.
I was able to reduce my medicine, and that's due to the fact of the Bad Sugar.
Call 1-866-257-3471. Operators are standing by. Or log on to PreventiveCareWeekly.com and place your order. Remember, knowledge is power. Bad Sugar DVDs will give you that power over diabetes. Get it now. Don't miss it.
Welcome back. If you are just joining us, today we've been talking about stress and disease. And with me is Dr. Ree and Joanne, who experienced high levels of stress as a result, ended up having hypertension, unfortunately. And Leon, who also experienced high levels of stress and ended up with hypertension. You are going to actually illustrate to us what goes on in the body when we have high levels of stress hormones.
Okay, if I can take a moment. Okay, this is something that will alert people's attention here. And when you actually have stress, ultimately, if the stress is uncontrolled, I feel that in my clinical practice, people actually get to depression. Okay, but on our way to depression, I'd like to explain what happens in our brain and our body in terms of the three hormones or brain chemicals that you can relate to. Three brain chemicals that I wanted to talk to you. Number one is serotonin.
Happy hormone.
Okay. And number two is dopamine.
Another happy hormone.
Okay, number three is, this is a mouthful, but I kind of mentioned that this is the same thing as adrenaline that's produced by the brain. Adrenaline is produced by actually another organ that I'm going to talk to you about in the next segment. But serotonin, dopamine, and norepinephrine. This is very much like the adrenaline that you're used to. Now, serotonin has to do with two things. Ruth said it's a happy hormone. It is a happy hormone, but this has more to do with stability. Okay, stability, feeling stable.
Feeling good.
Dopamine has to do with pleasure.
Ooh.
Okay, pleasure.
Feeling it high.
Pleasure and meaning. Okay. Okay. This is kind of more of a calmness, calm happiness. This is elation, joy, pleasure, but also meaningfulness. Okay. When you feel like your life is full of meaning, you actually have dopamine production. And this one, norepinephrine, has to do with concentration or alertness.
Helps you to think better.
Helps you to focus.
Yes.
So these are the three things that actually, three hormones that are always produced in our body that need to be in fine balance. Now, when you're under constant stress, you may have imbalance in any one of these hormones or all of the hormones. And most of the doctors actually use the mechanism of serotonin to actually help with the people who are depressed. Prozac is a famous medication for that. Now, as far as your uneasiness is concerned, it's probably the serotonin that was affected. If you have butterflies in your tummy, it's probably a combination of serotonin and norepinephrine imbalance. If you have too much or too little response, you can actually have a problem here. Now, when you actually feel like, I don't want to do anything, I have no pleasure in life, I have no fun, I don't enjoy the things that I used to enjoy anymore, then you have a problem with the dopamine mechanism. Now, when you have a problem with this, initially, when you're undergoing a lot of stress, you may have too much of this hormone. 2 arrows for very high stress.
So, Dr. Ray,
and this can actually lead to high blood pressure. And this is the primary brain chemical that will be released from the brain into your body, into your system. And namely, a lot of the organs are affected, but one of the key organs that is affected is circulatory system. And your circulatory system is not like a pipe, lead pipe. It's actually a very flexible muscle. And when you are under a lot of stress, these flexible muscles actually flex too much. They flex and they squeeze too much. And when you have same amount of blood and you're squeezing the container, what happens to the pressure?
It goes up.
It goes
Absolutely.
up. And this is something that you probably experienced.
Right.
And it actually comes with the tension, tension in your shoulder. You can also have tension headaches. And no matter what kind of muscle relaxant you take, you're always achy everywhere, especially in your neck and your shoulders. And this is something that you probably experienced.
Wow. Absolutely.
And then the fourth hormone that actually recently was discovered, how many of you heard of oxytocin?
Yes.
Oxytocin is a hormone that is for I want to be a little bit funny. Milk ejection and baby ejection.
It's a love hormone.
Okay.
It makes you want to hug.
But 16
That's
years
what you taught me in class. Dr. Ree actually was my professor.
Right.
Yes. So he taught
16
me
years
some
ago.
of these.
Right. 16 years ago, we didn't know. All we thought was it was good for milk ejection and baby ejection.
Yeah.
And it's the same hormone that actually helps you to trust. And it's a trust hormone.
Wow.
And when you don't have enough of this hormone flowing in your body, you actually you experience all of these in response to stress. But in response to stress, you also feel like you don't want to trust anybody. You don't trust anybody. But in the next segment, I may be able to explain and have time to explain how we can restore the balance so that you can actually have a normal life without taking mega doses of medications.
Now that I think you have a better understanding of what's going on, or actually what happened that led to high blood pressure. Do you have any question?
Is there any way to prevent this? Serotonin, I think, is produced when we exercise. Is that correct?
Okay.
Part of it.
Yeah, sure.
Yes.
Actually, I can actually explain to you how these things can be produced.
That's great.
So that you can restore your balance.
Yes.
And eventually prevent high blood pressure. And so I think in segment 2, I can probably get into that a little more.
I'm looking forward to
That
that.
is coming up on the next show. What about you, Leon? Any question?
My question was along the lines of what she just said. My exercising has reduced my blood pressure tremendously, so I believe that has to do with the serotonin.
Absolutely.
Or I can explain to you exactly what is produced in your body that actually lowers your blood pressure.
Absolutely.
Our body is able to actually make medications.
So you don't need to take them all the time.
Yeah,
exactly.
Synthetic ones.
And I think
Lifestyle.
oxytocin was familiar to me because I had induced labor.
That's right. They call it Pitocin in the labor and delivery to actually induce the uterine contraction.
Right.
But oxytocin does a lot more than milk ejection and baby ejection.
There you go.
And I can talk about that.
Yeah. So in summary, what have you learned and what advice do you have for others?
Well, first off, to recognize the fact, don't fool yourself. We know our body best.
Absolutely.
And we may not have the words or the knowledge or the education, but to just recognize that something's not right and to do everything you can to advocate for yourself.
Absolutely. And you, Leon?
When faced with the problem that you have high blood pressure, you need to get on it immediately, change and alter your lifestyle. 360, do a 360 and start eating right and exercising more, and that will bring your blood pressure down. That's what it's done for me.
Right, and it's all about lifestyle interventions.
Yes, it is.
Because there are no medications for stress. Well, I want to thank all of my guests for being here today. Thank you, Leon. Thank you, Joanne. Thank you, Dr. Ree. I will be seeing all of you on the next show. And for more information, please visit PreventiveCareWeekly.com and check out the forum where you can share ideas and learn from others about lifestyle practices and disease prevention. See you on the next episode. Goodbye.
This program is not intended to be diagnostic or prescriptive. Please consult with your doctor or healthcare provider before adopting any of the lifestyle changes or other measures discussed in this program. We do not recommend any medication changes. Rather, patients should seek medical advice from their doctors or healthcare providers.